Hi everyone, my name is Teresa Ferretti. I'm the co-founder and chief scientific officer of a nonprofit organization called Women's Brain Project, which studies sex and gender determinants to brain and mental health as the gateway to precision medicine. It is my pleasure to be here with you today and to be in a conversation with Dr. Carmela Tartaglia. Carmela is a Women's Brain Project collaborator. She is a cognitive neurologist at the University Health Network and an associate professor at the University of Toronto. Hi, Carmela. I would like to start talking with Carmela about how difficult is the diagnosis of Alzheimer's disease for both men and women. We know in oncology things can be different. I have a personal experience with breast cancer, and in my case, the diagnosis took less than 3 weeks. It was a molecular diagnosis based on biomarkers, and it was very precise. And based on that, also the subsequent therapeutic choices were tailored on my specific needs and my tumor. So this is in stark contrast with what we see with dementia. Patients affected by dementia, they can take up to 5 years to have a diagnosis. They have to see multiple specialists. There can be very often multiple mistakes on the way. So things are completely different. And I would like to start by asking you, Carmela, why do you think we lack this level of precision? Why is it so difficult to get this diagnosis in Alzheimer's? What are the barriers to a quick and precise diagnosis in Alzheimer's disease?
Thank you, Maria Teresa. So I think there are multiple barriers in Alzheimer's disease and other dementias. And one of the most important barriers is the misinformation that dementia actually equals Alzheimer's disease. In fact, they are very different. Dementia is an umbrella term that encompasses many different causes of dementia, including Alzheimer's disease, but also Parkinson's disease dementia, frontotemporal dementia, normal pressure hydrocephalus, primary progressive aphasia, HIV dementia, multiple sclerosis, so many different causes of dementia. And so we really need more biomarkers, and this is a big problem in Alzheimer's disease. Another important barrier is the stigma of diagnosis. So in many cases, families, patients don't really want to get the diagnosis or reveal the diagnosis. And so in some cases, this causes incredible delays. Another one is the low awareness of the disease. So it's not infrequent that patients will be told that they're aging when they complain to their doctors. And this is not aging. Alzheimer's disease and dementia is not normal aging. But in many cases, the healthcare professionals are not aware that they need to be looking for a diagnosis. Equally problematic is people who have young onset dementia, because in these cases, many of them are misdiagnosed with psychiatric illness. And then there's the heterogeneity of the signs and symptoms of dementia. And so, you know, we often think of Alzheimer's disease as being a memory problem, but many people will present with language problems, visual spatial processing problems, executive or behavioral changes. And when you present with these atypical forms, oftentimes you are misdiagnosed and it is very delayed in terms of getting the diagnosis.